vaccine that can result in the elimination of this virus. The virus, and it's a novel coronavirus, SARS-CoV-2, that appeared in late 2019. It has been responsible now for over 578,000 deaths. That's stunning, absolutely stunning. There are many aspects about this virus that we only, so it's a novel disease, novel virus. We did not understand initially that you could transmit the disease without any symptoms. And this disease is highly infectious. So we have learned that simple public health measures such as masks, hand washing, social distancing, and contact tracing are very important to avoid spread of the virus. The virus is dependent on a host. Without a host, it dies. So if we could just limit this virus, we will be successful in eliminating it.
Okay, and I'm just going to ask Dr. Underwood to jump in. We also have Dr. Underwood with us, medical director at Boston Scientific. He's been working to reduce health disparities for women and minorities since joining the Association of Black Cardiologists in 1990. He also founded the Center for African American Health in Arizona and is an advocate for the American Heart Association's community health initiatives in Phoenix. I'm not going to take up too much time, Dr. Underwood, but welcome. Did I leave anything out for you? Do you want to add anything?
No, just to say thank you very much for allowing us the opportunity to inform the group on what we have learned so far in terms of how to protect ourselves from the coronavirus. And it's certainly an honor to be here and to be back in front of the group and to serve in this manner. And again, thank you.
Okay, you're welcome. Dr. Nickens, I'm sure, it's safe to say that we're all so tired of COVID. We're tired of the mask, not having gatherings like we once had, being saddened by the loss of so many. And even as things begin to open up, we still have lots of questions. Although many of us have received the vaccine, many of us still have not. And I read today that according to the CDC, 58.5% of the adult population has had one vaccine. That's not saying fully vaccinated. So, and then out of that, it looks like only 20% are African American that have had one dose of the vaccine and 15% fully vaccinated. At these rates, how are we going to reach herd immunity? And oh, by the way, can you explain exactly what herd immunity is and how do we address the Black hesitancy in our community? And Dr. Underwood, please feel free to jump in.
So first, the term herd immunity is to try to get the right balance, depends on the level of infection. But if what you would like is that the opportunity to spread the disease is very, very low. So if you are, vaccinations we know will drop the level of infection. And that is the reason that we currently have come down from the very high levels of previous months, about 30% now, because of vaccinations that have been incredibly effective against this virus. 95% out of the hospital, a little bit lower for severe, for any illness at all, but the vaccines, all of them are very effective. So you mentioned hesitancy, Black hesitancy. And so there's a lot of hesitancy about this virus, and it's not specifically for African Americans. I think African Americans, for very valid, historically, have reason to be suspicious or concerned about taking something, having some injection, and not clear if it's is it an experiment, or is it going to help me or not, and feeling somewhat mistrustful. So I understand that urge, but the evidence is overwhelming, and it has been tested in African Americans, minorities, as well as women, and just recently, as you know, in children. However, I don't want to confuse hesitancy with access. And I think that that often gets confused. And also, being concerned and having questions about taking the vaccination is not the same as refusing to have the vaccination. So I think this administration has really gone about this very methodically. Minority, it was recognized early that minority communities would have some difficulty. Yes, there's hesitancy, but also we're not in the medical system in the same way that, if you don't have health insurance, for all the reasons that we have health disparities, and we tend to have higher levels of disease, of preventable or risk factors that we can control, it has more to do with not having access to the best information and not having access to care. But I believe that when we are in the community, which we are trying to do, and have community leaders and are present, take the vaccine to the people, don't expect the people to come to the vaccine, we will improve not only our rates, but we want to get this as high, our vaccination level as high as possible, because as you know, African Americans and other minorities, Native Americans in particular, but Hispanics also have higher, not just rates of infections, but higher death rates. But I think that is not some inherent susceptibility to this disease, but I think it may be symptomatic of the same poor access, social determinants of health, physical, structural barriers that make it more difficult for people of color and women to not only have good access, but it also is a challenge to practice the public health measures, the simple things that everyone can do.
Well, you mentioned poor access, and I certainly understand that. However, the people that I've been talking to are making a decision not to get the vaccine.
Right. I think some of this it's a political decision or some sort of a social decision, perhaps even promulgated by what we see on the media, where people are expecting African Americans to be hesitant about this because of past misgivings with like clinical research. Right. I think that's typically how it comes about, even though vaccination isn't a research protocol. This has nothing to do with research. And you hear these misgivings mixed in with how quickly it was developed and how quickly it was approved by the FDA, and could that be possible or not, and it still be, a worthwhile, viable product. And these types of myths and I guess misconceptions are perhaps, people who are less informed, as African Americans have been, may be more susceptible to this, because these thoughts are not generated by science. It's more of a stance that I don't want to be vaccinated. I don't want the government to tell me what to do and to, stick a needle in my arm and inject me with something.
Yeah.
Okay, gotcha.
I think it's important to recognize. Oh, go ahead, Paul. I'm sorry.
I was going to say this: if you look back at other immunizations that children get typically to go to school, you don't really see a lot of pushback from African Americans to get these vaccines. Right there, I can't say that there aren't groups that push back on it, but it isn't really a anti-vaccine sentiment isn't really a strong African American characteristic. And this is something that's been brought up, I think, by the political environment that was developing around the coronavirus epidemic, pandemic, and during the development of the vaccines.
Okay, we do have a question, Kathy Mohammed, if you can unmute yourself.
Oh, yes. Hello. Yes, my question was, I just want to know, once we have gotten a second vaccine, is down the road, will we be required to get a booster shot for the vaccine? That's what I've heard.
Yeah, that's a excellent question. And the reason we don't know is because this is a new virus. The vaccine, the Moderna and Pfizer vaccine, use a little different technology than the previous vaccines that are available. And so the answer is we don't know, and we're testing to see that. A reason for another booster, though, is not just that the vaccine, if you will, wears off, but just like the flu vaccine that you get annually or every 2 years, depending what how the flu changes. But the point is that the virus itself mutates. And so you are protected against what is now prevalent and infecting our communities. But that can change. That's another reason that we want herd immunity. We want this level of virus so low that the virus can't linger. It's basically dying because if it festers as it's growing, for example, in India where it's unchecked, that level of virus allows the virus to change. And so there's a need to update the vaccine and get a booster.
Okay, and my next question is, I wanted to know, what is the difference between the first shot and the second shot? Because I have read the same statistic that 50% or quite a few people are saying, okay, I'm taking that one shot, but I'm not going back for the second. So could you tell me what the difference between the two are?
I can take a stab at that. So the vaccine is I'm trying to think of a metaphor, but it's like like small army ants. You start out and you test to see if you can recognize this. So your initial inoculation is and it's actually a spike protein. They have manufactured with RNA a part of the virus that is easily recognized, and it shows your immune system this foreign protein that you want to protect against. And so the initial inoculation just readies the system, and the second vaccination helps to strengthen the army against this protein. And so you do get some level of immunity with just the first shot. But after the second shot, within 2 weeks, you go from something like a 40 to 50% coverage up to 95% protection against the exposure. As it happens, the vaccine, the 2 shots, is more effective than even natural immunity that you achieve if you are actually infected with the virus. So people that have had COVID, whether it's a mild asymptomatic or even have been ill with COVID, there is a waiting period, but it's recommended that you get the vaccine because you are less likely to be reinfected with the vaccine than you are with just the natural disease.
Okay, thank you.
Okay, any other questions? We have a caller on the line. Can you identify yourself?
Betty Harris.
Oh, hi, Betty. Thanks.
Hello.
Thank you for joining us. Did you have a question for the doctors?
No, I think that they have been answered because I've gotten both of my vaccinations, one in January and one in February. And one of the questions that was asked about a booster, and I don't think anyone knows exactly if we're going to have a booster in 6 months or a year, just like the flu vaccination. So that was going to be my question. Is it going to be that? Yeah.
Okay, thank you for joining us. So I still have a question out there about the herd immunity. Do you have any idea? I know things are opening up and it looks like we are on our way, but at the rates that they are at right now, with 58% having had one vaccine, when, is there any way you can predict when we will have reached full herd immunity?
So this is very elusive, and Paul may want to check me on this, but so the idea is that the level of infection is so low that your risk of exposure to someone who is susceptible is low. And so ideally that's what you want. So if in an ideal world, we would have a 100% vaccination, and that would eliminate the virus. We would feel very comfortable with that. That's so we don't live in an autocracy, so we can't force every person. At least we don't think that we'll need to do that. And the question is, what level of vaccination across the board is needed? And that, so we want that to be as high as possible. I think even our experts, you've heard shifts from 60%, 80%, 90%. Obviously, the higher the better. But I think the part that is very deceptive about this is that it's communities, and it's global, it's worldwide, and it's also communities. So if the overall rates are very high, but your community, so I'm from New York and I came from Queens, and I was just so disappointed to hear that the Queen, so New York is applauded as one of the places that has really done very well with getting vaccinations to everyone, et cetera. But the borough of Queens is only about 20% vaccinated. And that's one of the boroughs of New York. So in Manhattan, that's fine. But if you have the people from Queens going to Manhattan, or if you happen to be spending your day in Queens, if you're vaccinated, it may, what we think is still, we're not sure, we would be lucky if you're vaccinated that you can't carry the disease. But if you're vaccinated, even though you don't get the disease, you could have this carrier state. So if you're exposed to someone who has the disease or some variant, and then you go back to to where you are, that 1 out of 10, that 10% that has not been protected, you can give them the disease. And you've seen how quickly the disease spread unchecked. Of course, we didn't practice the public health measures, but we also were not vaccinated. So this is still a ticking time bomb, that it's very important that we try our best to get that level so low that this is a disease that is so low in incidence that the risk of being exposed is low. And that would help keep these incident, not only are we able to handle the very sick, but it also means that we can quickly contact trace, treat that person, identify the people that they may have been exposed to, and we can stay on top of this disease. So we're not looking to 100% vaccinate to say that we can now open up, but we want to get to a very comfortable level that, so right now I'm vaccinated and protected. I wear a mask all the time, as much to, not so much to protect myself, but to protect myself from carrying the disease. And to be honest, I'm not sure of the people that are not masked. Are they vaccinated, or do they think they just don't need to wear a mask? And until we have a real public awareness and consensus, and that we have the same truths, I think that makes it very clumsy and very easy to make very safe public health measures and vaccination ineffective because of people that are smarter than what science tells us, and they are allowing this virus to linger.
Wow, Dr.
I think that
Underwood.
also, I'll just interject one thing or a couple things. The vaccines have been shown to be very effective at preventing severe illness and death, but the vaccine does not mean that you cannot contract, the virus on your own and just be sick. So just to keep that in mind, that I personally don't want to be sick. I definitely do not want to be severely ill and die from this, but I don't really want to be sick at all. And to Dr. Nickens' point, I don't want to transmit this to anybody else. So I think that we still need to be very careful.
Wait a
I'll
minute.
also
That's very important. Wait a minute. So are you saying that you can still get the virus being fully vaccinated? It just prevents you from getting really sick?
And dying, correct. That's the vaccine has been very effective, extremely very effective in preventing death from COVID-19, right? But it is not like 100% against people just not getting COVID at all.
Wow. Wow. We do have a question. I'll let that
Can I just, before
sink
you take the
in.
question, just before you take the question, I just want to make a point because, you know, the perfect should not be the enemy of the good. And, you know, we get colds, people get, my daughter, 25 years old, had the vaccine and she had a reaction to the second vaccine. She was saying, you know, I forgot what it was like to be sick. And she was, you know, had a fever for a day. I don't want to minimize her illness, but she was actually sick. But she's, you know, within 48 hours, she was back to normal and she was healthy. And, you know, getting sick, you know, having a cough, even being in bed for a day or two, no one wants to get sick, but that's not spending 3 weeks on a ventilator and being isolated and die. And if you've not seen the horror that can be the consequence of this very lethal, very contagious, but very aggressive, deadly virus, to not, I don't want anybody to think, well, if I get the vaccine, I can still get ill, so why take the vaccine? You will be alive. That is a big deal. That was not true. And you know, the New Yorker, you know, those are folks that get vaccinated because they have seen you know, the meat trucks and the body bags to remind them that this is really a deadly disease. So preventing that severe illness is a big deal and very worthwhile to get the vaccine.
Okay, Daphne had a comment or question. Daphne, are you there? Daphne Ferdinand?
I'm sorry. It took me a little while to get off of mute. Hi, everyone. This is what we're dealing with. I'm from New Orleans and I work with different community groups, but I'm always asking this question of those who have quite a few of significant expertise in the field. We have some significant vaccine hesitancy here in New Orleans. We were on a roll before, and then somehow or another it just plateaued. And even with a number of people who have a significant formal education, refuse to get the vaccine. How do you, what are some strategies or what are some ways that you think that we can effectively work with community to overcome this hesitancy?
So I can comment about that. And it is a difficult, you know, true hesitancy is a reality, but we must have patience. And there are different you know, what somehow captures the attention and the common sense of one person is different from another. But generally speaking, focus groups, having panels with different people who have different perspectives of why. But I have seen, gone into groups where you're first thought in listening to them talk about the virus, and a lot of, and I'm not suggesting that anyone in New Orleans or anyplace else, but there's a lot of misinformation and very strong reaction to, you can't tell me what to do. I don't believe that the vaccine is safe. You know, a lot of issues that have to go through. But when you have a panel that talks and give real stories, understanding, for example, a real story of a 25-year-old that died of this disease, or real story of 64-year-old couple, the husband is a runner, and the woman, healthy, etc. And one gets the disease, the next gets in within a week, they both have the disease, and in 3 weeks, they're both buried. They're just different stories of, the limited exposure, and they get the disease, some recover, some don't. But, the idea that you can prevent this tragedy, with real stories, I think really helps people to see that. One of the things we haven't had a chance to talk about at all is that, it's still, and what's called emergency access, it's not fully approved. So is it still experimental, et cetera? Well, the nature of this virus was so deadly that the NIH and that was then Donald Trump as president, who authorized the warp speed to vaccine development. But people may not understand that not a step was skipped. It takes about 30,000 for vaccines, a test in about 30,000 people to establish safety and efficacy. All of those steps have been completed, and the emergency access has to do with the fact that the level of not just infection, but deaths, 3,000 deaths a day, 10,000 deaths a day. I mean, it's just unbelievable morbidity, mortality. Why this vaccine had, was not rushed, but was moved. What is normally done serially, one step after the other, was done in parallel so that multiple steps were being done simultaneously. And some of the things that were done were cost ineffective. If it failed, we were just very, very lucky. And I also want to say that it was over a decade of research that has been building. So most of us know Dr. Fauci, but the NIAID laboratories that have been looking at vaccine, how to do vaccines. But this mRNA vaccine is a technology that has been a decade in making. And so they chose well, they were lucky. Science is very detailed, very specific, but they were lucky and it has worked. So yes, it's early, but it has proven effective. And as it happens, we expect in the next month to have full approval of the Pfizer and Moderna vaccine, and probably Johnson & Johnson to follow.
So that's a good point. That's a good comeback as far as the reality of the deaths that has been occurring. 3,000 deaths a day. I mean, if someone doesn't take note of that, I mean, that is a hard reality. So thank you for bringing that. And then I didn't know that you talk about there's been over a decade of research put into this. People don't hear that. People don't hear that. They don't know that part. And over 30,000 tested. Oh, that's great news and information. I think they need to talk about that a little bit more. But the question that came to my mind, and maybe you can speak to this, Dr. Underwood, is, okay, so the people that have been vaccinated, we're all happy, we're fully vaccinated. It's been past our 2 weeks, now we're traveling. So if we go out and travel, and there's others that have not been vaccinated, could we then bring that back into our home, or?
So that is what is unknown. And there have been some reports that once you've been vaccinated, that it may be difficult for you to carry the vaccine in that way. However, I think until that's better known, we would still be very careful to continue wearing masks and the social distancing that we've been doing before, to make sure that the virus doesn't actually spread with us as we travel from place to place.
Mm-hmm. Okay, good. Let's go back to our viewers. Any other questions for the doctors?
I have a question.
Okay. Go right ahead.
I have been, last year, we have a private swim club. And last year, we just had medical members only. It was wonderful because we could get out and we had no COVID cases. Now this year, everybody, all, the governors and everybody say, oh, we're going to open up. There are people that, unfortunately, for those who had to continue working and doing everything that they did otherwise, they don't feel the same ways that those of us who have been inside feel. So they want to sort of open things up. How do I convince them that things are not normal and we should proceed with caution?
I think that's a very good question, and I think it raises 2 points. And one of them is that now that we have been in the mode of the social distancing, mask wearing, vaccination, and really been isolated during the pandemic, now that things open up, we feel uncomfortable going out and socializing again, definitely. And just as you pointed out, there are a group of people who really aren't as diligent about what we feel is safety as we have been all along, or for whatever reason. And that is certainly a balance. But I still feel that, we are all tired of being within the pandemic. But to have another spike because we have been careless and because we were so anxious to get back to what we consider normal that we let our guards down, and the virus has now come in with a variant that can run rampant again within our ranks. Is something that we really need to guard against, and we need to be careful until we reach that point of the herd immunity, that we are confident that the virus is really on its way out and has been controlled.
Mm-hmm. Hmm.
Did someone else have a question?
I have a question in reference to minors. During this pandemic in the last year and a half or so, you haven't heard, and maybe you all have, of minors. When I'm saying minors, I'm thinking of young people under 12 years of age, being, having the virus as often as you heard of older people. And matter of fact, I would say 18 and down. Now, I heard recently on the news that they said something about the younger people may be anti-systematic. But, now thinking about it, statistic-wise, have you heard of many minors? There were quite a few people that left here. I have friends that have passed away, family members that have passed away with the virus, but no one like, say, under 18. Has there any statistics been on that, or?
Right. So just from what I know, and certainly Dr. Nickens is an expert, but I have certainly been made aware of cases of minors becoming sick with COVID and dying. Unfortunately, it seems as if there's a syndrome for children where they have a lot of inflammation, like a storm of inflammation within their body, and then they succumb. For some reason, that seems to be more common in African Americans. And then you have also probably been made aware of teachers who are in schools who become infected, and they can become ill. And some of them are severely ill, and some of them do pass. Those transmissions came from minors, but the minors may not have been symptomatic. So,
okay, I know of. Yeah, right. I know of a case.
Just here recently, last week, they talked about cases in schools in Radnor, Montgomery County, near Philadelphia. But they said that the virus came through an air vent. An air vent was not sufficient. It was broken. Children in the classroom became sick.
I don't think we completely understand why children, particularly very young children, seem to be somewhat resistant to this virus. But as Paul pointed out, there is a syndrome that's very severe that is in children. And MSNBC, they do they end one of their evening shows with a tribute to someone who has died. And I was surprised that they talked about a 15-year-old African-American girl who was just a joy. And she was mild symptoms. She was tested positive, and within 2 days, she died from a myocarditis. So, so generally speaking, they are, they're somewhat resistant, resilient, but this is a very deadly virus. You do well to not be exposed or be protected. So children between 12 and 15 are being tested now, and I'm sure that from the very young will be tested next. And but the resistance of younger, healthy adults is real, and it's so real that a global issue is, should we be pushing to use a vaccine for healthy teenagers and young adults, as opposed to trying to push the vaccine worldwide to countries that, middle income, lower income countries that are far behind in vaccination. So India, as you know, is devastated with the disease, and almost no vaccine capacity at the moment. So this is, it's not just a US problem, it's a world problem, because not, it's the right thing to do, but it's also, I don't want to say selfish, but we have to control this worldwide, because it will, it will spread, it will mutate, and it will come back at us. So, yeah.
Thank you. Any other questions? Kathy, you had a comment. I can read it. Kathy says, I think of it as saving your life, the vaccine, by taking action, just like quitting smoking. By putting down cigarettes, it's your choice to live or die. That's a good point, Kathy. Thank you for that.
You're welcome.
Yeah. So the other thing, one of the things is the what do you call it? The antibody infusion. So some of you know that I did have the vaccine. I mean the COVID, and I had an antibody infusion, and they said that was to prevent me from getting sick, more sick, and from being hospitalized. However, I learned that I could not get the second vaccine because I had that. I had to, let me rephrase it. I had to wait 3 months before I can get the infusion. So that is something that's a point that I don't think people are aware of. If you're considered high risk, that is an option to have the antibody infusion, but it does interfere if you're in between shots. That's what I want to say. Yeah. So either one of you, if one of the doctors want to touch on that, I mean, people need to know these things.
So it sounds to me as if you had one shot and then you got sick.
Yes.
Okay, so that lets us know why, I mean, that's an example of why one might want to push for 2 shots, right? Just right off the bat, why 2 shots would be needed. This, as far as I'm concerned, this is uncharted waters. We've never had this situation before where we've had a global pandemic, but we also have many, many immunologic tools that we can use to combat the virus. Because if you recall, we don't really have a lot of tools to combat viruses, and that's why they're so devastating, particularly this one, which is very dangerous. So just knowing what we know about the immunology of how your antibodies are after you've had the virus and after you've had these other antibodies, would that second vaccine be effective in raising your antibody level if if you had other antibodies already in your body, that would be, it could be almost considered like potentially wasting a dose. But we don't know, right? And so that's the reason for caution, and to have experts like, Dr. Fauci and teams at predominantly like NIH and FDA and CDC to look at the situation and try to determine what's going to be most effective for you, so that, obviously the first dose didn't completely protect you, and how to make sure that you're going to get the most out of the second dose, to wait for your immune system to be ready to take it.
It was my fault, because I felt like when I had the first dose, woohoo, I can go out and I can do something, It was 2 days later that I was exposed. So there wasn't enough time, I believe,
Right.
that
I
passed before I got infected.
No,
Yeah.
I agree with what you're saying, and I'm not blaming you, and I'm not saying that you were going after a single shot, but I did just want to underscore the fact of why the need is there for 2 shots, and the need to be careful. And again, to Dr. Nickens' point, that these vaccines are just alerting your body to the presence of this contagion, this invader. And what we're trying to do is to make it so that your body can fight it immediately, as opposed to having to wait 2 or 3 days to rev up your own immunity for it. We want you to be able to fight it as soon as it comes to you. We want your body to kill it, as opposed to having to wait for it to trickle down your throat and get to your lungs before your body's all revved up, because by then it could possibly be too late.
Mm-hmm. It's a touchy subject, especially when you have people out there that don't want to get the vaccine. Some people I've talked to don't even want to get tested. And so it's like you're trying to be excited about possibly everything opening back up and no more isolation or quarantining. But then it's still people out there with that mentality. You're not going to make me get the vaccine. I don't want to get a test. I don't want them sticking something way up my nose. Somebody told me, I heard that they stick it way up to your brain. No, I'm not going to do that. I'm like, I mean, these are real people with what they say. And so the other thing is, traveling. Of course, we all want to get out there. We want to be around people. We're social animals. But, and then some places, it's like the vaccine doesn't exist. I was in line at the store the other day, and one guy behind me said, oh, I forgot, you guys wear masks here. And I turned around, I was like, where are you from? I forget what part of the country he said he was from. He said, but we don't have the restriction on masks anymore. We don't wear masks. And it's just like, why is it that, a lot of people from someplace else don't wear the mask, and we're all trying to wear the mask and do the right thing. I know in my area anyway. So it's just this wide difference. So if you're traveling, like I'm trying to travel next month, and I talked to someone there, and they said, well, most people don't wear it here. I'm like, why?
Okay, so I think that that's political, and these are people who are taking basically an anti-government stance, right? And they have badgered people. There were here in Arizona. The governor has lifted the mask mandates, even though the cities, the mayors, are trying to enforce mask mandates. And so you see people walking around without a mask only because it's not the law that they have to do it. So they're very comfortable doing this. They also showed up armed with weapons at the school board meetings, demanding that they start having the students go back to school, right?
Oh my.
I mean, aren't like with their guns and stuff at a school board meeting, demanding that they open up the school so the children can go back in. And not thinking about the children, but not thinking about the adults that are at the school too, like the teachers. there's a lot of sentiment that goes along with it, and I think that just underscores the political nature of some of these decisions that people are making.
Mm.
Okay, someone said, can the speakers comment on the proposed booster shot? I think we did touch on the proposed booster shot, but you want to go ahead again and touch on that? Either one of you?
She's muted.
You're on
I
mute.
have a question about that because, you know, when you get the vaccine, they tell you don't get vaccinated for 12 weeks. Don't get anything else. Is that why you don't get the monocromial, the booster?
Yeah, so the booster, the idea of whether you need a booster or not has to do with that over time there may be a variation of the COVID virus that's available, and so you may be protected against some strains, but not the latest strain that's there. The other thing is that this is a new vaccine. We don't know how long the immune response that is triggered by these vaccines, how long that lasts. So it could last forever, but they don't think that that's true. So between the possibility that your immune system over time becomes less sensitized, less able to recognize the invasion, then that's why you would have a booster. But we liken this to the flu shot, which you get every year, every other year. And that flu shot is not the same. They change it to meet the strains of flu that they think will be prevalent in various areas. So really it's trying to stay ahead of the virus to keep it at a very low level so that hopefully if there are cases, they can be easily managed. And for the most part, the vaccine protects the general population.
Any more questions?
Florence, it's Barbara. Not a question. It's just a affirmation of your presence here that I would like to say to the doctors, Dr. Nickens and Dr. Underwood. Thank you so much for your commitment to coming out and sharing your knowledge, because it is reaffirming to hear it. You know, when you go on and turn on the news, they get more idiotic every day playing a game, you know, on who's in power. It's very sad. But you get tired. And so the answer to that is people, well, why are you watching that? You know, so this is a great difference.
Well,
but it does, just to listen to all of you, and I thank you all so much, because I'm now in a situation where people are feeling better. I just had a meeting now there. We used to have the Zoom meetings. Now it's in person. It's just starting. And folks are, you know, I went to a meeting, nobody had a mask because they're, oh, no, you can come. And folks do forget, they want to hug each other. So it's very awkward, you know, to sit and when everybody is so glad to see you. So mine is, if you get the booster, when do you know, how long does it last? I mean, because these folks are thinking they're well and everything.
So I can't say enough, and I think Paul already expressed, it's really an honor to be here. And if we can convey information that helps you make a good decision, that's very rewarding. The booster information, I think we have to pay attention to science as it develops. And at the moment, right now, it's 2 shots. They are anticipating. So we've been very lucky. The variants that have been identified, which are more contagious, they seem to have the current vaccines protect against them. So how long that's true, you know, we keep our fingers crossed that remains true. One thing for sure, if we can step up and continue very high vaccination rates, that containing the virus to the lowest level is the best way to force it. It needs us to grow and it's like a survival tactic to get to have these various strains so that they can survive. So if we can contain it, it will die, it will go away. So I hope we can stay ahead of it with vaccinations.
Thank you.
Thank you. Any closing thoughts, Dr. Underwood?
No, again, it's a pleasure and an honor to be in front of you and the group. And if there are questions that come up along the way, then I'm sure that they can certainly express them to you. And you can, as you well know, we're in very close communication. So we really are very committed to making sure that our communities are healthy. And I really do appreciate you for taking the time out to listen to what we had to say, and then to take this back to your communities and practice it yourself. Thank you.
Thank you.
Thank you so much.
Closing thoughts. Oh, someone had a question? Okay. Dr. Nickens? Any closing thoughts?
Yeah, no, again, thank you so much for having me. If you know someone that is resistant to vaccine, don't attack them. Just sit and talk. And if they listen, why, what is it meant for you? Why did you decide to do it? Real stories. People understand that, are much more moved by understanding that it's a reasonable choice and that it protects you and it protects others. And as we do a lot of, we're capable of great mischief, but as a species, we do a lot of great things, and people actually do the right thing, not only for themselves, but to help protect others. So I think, just reaching out to people's humanity. This is a vaccine that the track record is very good, very safe, very effective.
Thank you so much. Thank you. Thank you, everyone, for sharing your time with us to learn a little something, to carry it back to your communities. Thank you so much, Dr. Underwood and Dr. Nickens, for your valuable time and knowledge on the subject. This is Florence Champagne with the Open My Heart Foundation. This is National Women's Health Week. Join us again tomorrow, where we'll be line dancing from the heart with Betty Harris. And on Thursday, we'll be doing yoga with Sherelle Moore Thomas. So please join us 7 o'clock each night. And if you have any questions, you know how to reach me. You can inbox me. But this was very, very important that we address this once again, as we still face COVID. So be safe out there. Thanks again.
Thank you, Florence.
Thank you, everyone. It was great.
Thank
Thank you
you.
so much for the information. So much. So
You're
excellent.
welcome.
Thank you,
Bye-bye.
both doctors. Thank
Yeah,
you.
thank
Thank you,
you.
Florence.
You're
For the
welcome.
doctors, I wish, is there anyone we can write, to applaud you? Would that be helpful?
You want to? I can certainly receive
Yeah.
the information and forward it to them.
Yeah.
Barbara, thank you so
Yeah,
much for
I
joining.
look forward to the next panel with the doctors. It was great.
Yeah, it was excellent. And I just think that we should, as a group, if they would share where to go. I don't take things for granted because, people are just not kind these days sometimes.
That's
Yeah.
true.
So when it's good, we have to learn to say thank you.
Yes.
And so I'll talk to you about it, Florence.
Okay. Okay.
Good
Okay.
idea.
Yeah.
Thank you so much. Thank you. I appreciate
you
it so
all.
much.
All right,
Good night,
thank you.
ladies.
Thank you all. Good
See you
night.
Good night,
tomorrow.
sir.
Good
Yes.
night.
Good night.
Bye.
Thanks, Florence.
You're welcome. Bye-bye.
Yeah. Put it in writing.
Put it in
Yes.
writing.
That's true.